For women and men considering minimally invasive, so like Botox or fillers for an area, one important concept with minimally invasive is what kind of line it is. Because most people, they're worried about a line or a wrinkle they have somewhere. And there's two different kinds. There's the static line, meaning that wrinkle is there all the time, even at rest. And then there's the dynamic line, meaning that at rest, it's pretty smooth, but whenever you activate your muscles, so whenever you frown big, you get a line that's not there except when you're frowning big, okay? And so that's a dynamic wrinkle. And we treat the two very differently. If you're flat at rest and that line only forms whenever you move your muscles, then we put Botox in those muscles. We keep them from moving, and therefore we keep the line from forming, okay? And that's more of a prevention kind of thing. You get it done every 3, 4, 5 months. If you don't form that line over and over, if you don't crease that piece of paper continually, then it won't start hanging around. But once it's hanging around, and you'll see this sometimes in people in their 20s, you'll see the same thing in people in their 50s that don't have a line. So it's not so much on age, there's some component of genetics and sun exposure and that kind of stuff. But once the line is hanging around, and we put some filler underneath that wrinkle, and we get it to lift up. If at rest there's no line, there's no reason to put filler in there, because then what you get at rest is a lump, you know, and when you're frowning, then it might be flat, but the real cure for that patient would be Botox.
The options that we have with fillers that are different now than when I started into practice 18 years ago. In the late 1990s, what we had was collagen. Well, it never lasted very long. And if we had an effect we didn't like, there wasn't really much you could do besides wait for it to go away. With the fillers that started to come about after that are based on hyaluronic acid, these are the things that people know by name as Juvederm or Restylane or Belotero. Those are things that are a naturally occurring substance in your skin and that we can inject that last longer. The way they hook the molecules together, they can last from 6 months, 9 months, a year, 2 years now for some of these fillers. And we have an antidote. If there is something that we don't like about them, you can dissolve them. And so that's nice that they are reversible. People want things that are permanent, and I can understand that because a patient will say, well, I don't like having to come in every year or every 6 months to do this. Understandable. But with permanent can come permanent problems. If you get something you don't like and it's been a permanent filler, you've got a permanent issue, or it's one that's going to take something dramatically invasive to try and repair.